is National Diabetes Month in the United States. November is National Diabetes Month. And I wanted to ask you, what if you could break up with type 2 diabetes in just 40 days and take back control of your health, your joy, and even where you live? Whether you are planning on moving abroad, you're globe trotting, or you want to remain where you are, this conversation that we're going to have this evening is for you. And some of the stats, my channel focuses on educating predominantly Black women because I'm a Black woman, and unfortunately, Black women have the highest rates of a number of things, whether it's cancer, heart disease, and also diabetes when we compare ourselves to our white counterparts. So approximately 12.1% of non-Hispanic Black adults in the US have diabetes, which is disproportionately higher when you're comparing us to non-Hispanic white adults. But when you break that down and look at gender, and specifically looking at Black women, approximately 12.7% to 14.1% of Black women have been diagnosed with diabetes, depending on the source and the age range. What do I mean by that? When you break it down, essentially when someone is diagnosed with diabetes, it's around 12.7% of Black women that have been diagnosed with a case of diabetes. There are some that are not diagnosed. So when you calculate or factor in the undiagnosed cases, that total prevalence changes to about 17.4%. And then when you even look at some other demographics, particularly older women, the rate is actually higher for older women. Approximately 1 in 4 Black women over the age of 55 has diabetes. So given that November is National Diabetes Month, and this powerful conversation is for every Black woman who's been told that type 2 diabetes is a lifelong sentence. Spoiler alert, it's not. Okay. And we're going to get into that discussion. So I hope you have your pen and pad, okay, to take notes. And I want you to feel free to drop any questions in the chat, as we are going to make this as interactive as possible. Okay. So thank you all for joining me on this live. For those of you that don't know, I am Dr. Natasha Ramontal, also known as the Medical Tourism RN. I'm an RN and board certified patient advocate. So welcome to my channel. And for those watching the replay in the future, welcome. All right. I am honored to introduce my guest this evening, Barbara G. Samuels. And one of the questions I had was, you have been so entrenched in type 2 diabetes, whether it was through pre-diabetics or those with type 2 diabetes. I wanted to hear more about what your personal journey was with type 2 diabetes that made you decide to work specifically in this niche.
So it is so funny. My personal journey started in my home. As a matter of fact, my husband was diagnosed with type 2 diabetes. And, being a nurse at the time, I was a nurse for over 15, 16 years. My girls were young. And I thought, well, you know what? I'm a nurse. I know all these things. So I decided I was going to, take care of him the way I've always known. But then I realized that I see my almost 6'2" husband, young, full of energy, slowly diminishing before me. He would come home from work. He would just fall asleep on the couch. His children were saying, Daddy's not playing with us anymore. He was constantly tired. The medication wasn't working. And then I noticed one day, one morning we woke up and his mouth was all swollen. He was diagnosed with, of course, hypertension, diabetes. He had angioedema, where his tongue was so swollen. And he realized that this wasn't helping. So we made a deal. Initially, when he was diagnosed, I tried to get him to change and go the way that I was going, because before even diabetes, I was diagnosed with hypertension. I was able to totally reverse that. But he wasn't really in for it until the day he got angioedema. And once that happened, then he came on board. And so in 30 days, we were able to reverse his type 2 diabetes using the natural methods. And that changed everything. Friends and family started asking. I started doing it just for fun. And then I realized that I could help more people. So yeah, that's where that journey started. It's become my passion.
before we continue, and I think this is important, we had some technical difficulties before, but one of the viewers, Shirley and MD, says, Miss Barbara, we pray that any family and your friends of yours in Jamaica during this passing of the hurricane remain safe. Just want to say thank you all for those, because like Miss Barbara, I'm also Jamaican, so it has been a huge hit to our island country, but we are extremely resilient and we will rebuild and rebuild stronger, Jamaica strong. So thank you for that. And Miss Barbara, if you want to say any words about that.
Yes, and yes, a few of my family have been affected, but they are alive. Nobody has lost life, and we are even more determined that we will come back stronger. That's
That's right.
who we are.
Amen. Exactly. Same. My family had structural damage, but thank God no loss of life. So thank you for that, Shirley and MD. Getting back to this, something I wanted to talk about, because something that I hear a lot, and even at one point before I became a nurse, I kind of wondered this myself. When you start talking about understanding diabetes reversal, a lot of people think because maybe my mother or my father had it or some other family member, that it's genetic. So many people are told that diabetes type 2 is just a genetic thing and it's unavoidable. What do you say to someone who feels hopeless?
Well, I can say, first of all, I want to say I feel your pain, because that's what we've all been told all our lives. And I used to believe that too, before I came into this revelation of the knowledge that that was not the case. And the truth of the matter is, type 2 diabetes is not genetic. It is lifestyle, it is culture, it is tradition, but it's not genetic.
Wow.
I always say, lifestyle, your family can have a predisposition to a particular disease, but your lifestyle and your actions, it's like you're having a gun that's loaded, but it's not going off. But when your lifestyle and the actions you take doesn't align, then it's like shooting the gun. So you can have a loaded gun or a family history, but it doesn't mean that you have to have it. And type 2 diabetes is a disease that I've realized is passed down, not genetically, but because of tradition, because of the way we eat, the way we think, the way we live, and the things we believe. So no, it's not. It's definitely not a genetic disease, because if that's the case, then practically everybody would have type 2 diabetes, and
I
that's
agree. It's that common. That's true. That's true. And it's interesting, because what I noticed, at least in my own situation with my parents, is that they didn't have it between the ages of their 30s, 40s. I think that they actually got it in their 60s, later on in life, when they weren't moving as much. Now they walk all the time, but they weren't. They were a bit more sedentary, and I think their lifestyle, in terms of the way they were eating, was maybe a little bit more starchy foods, sometimes sugary things. Can you tell us a little bit about the term that you use, reversal, when you're talking about type 2 diabetes, versus not the management of it? Can you explain the difference?
So it goes right back, Dr. Natasha, back to the understanding. So when you think about managing disease, first of all, there's a verse that I live by. It says, "A curse causeless does not come." We are so focused on dealing with symptoms that we forget to put at the underlying cause. And the reason why it is not manageable but is reversible is because the underlying cause is insulin resistance, right? And when you think about type 2 diabetes, because the cause is insulin resistance, the medications and the stuff that you're taking, all it's doing, it's like almost, what do you say, covering the symptoms.
Okay.
It covers the symptom, but it doesn't fix the insulin resistance. It's like your body, for type 2 diabetes, it's not that you lack insulin, it's that your body's ability to use the sugar, use the glucose that's in your body, and the insulin is still there. It's just maybe not as much, because now you have more. Your body has more sugar, and it's almost as though your cells have decided, listen, we've had enough of this insulin coming, we're putting in a resistance. So when you start adding more insulin to something that's already resisting, you're just covering. You're covering for a long time while the inflammation happens. As a matter of fact, type 2 diabetes is a disease of inflammation.
Oh, wow. I've
It is
never heard it
really,
referred to
it is
that
a
way.
disease of inflammation because, and I always say, if you think about, if you've ever had a toothache as a child or even as an adult, you can see how horrible that pain is. So
Mhm,
just imagine, and it's usually because there's sugar buildup on your teeth and it tears down the enamel, right?
mhm,
With type 2 diabetes, this sugar or this excess glucose outside of the cell causes the fine, the fine mastery of the body, the cells, everything from the crown of your head to the sole of your feet to become so inflamed. And so what is happening, they start breaking down, just like how your tooth in that. But just the tooth is hard, but
mhm,
your vessels are very fragile. So
mhm,
type 2 diabetes is a disease of inflammation. And
mhm.
when you think about the inflammatory effect of excess sugar in the blood, you are creating like a whole dynamics of just one thing after the other, after the other, after the other. So
Right.
it is not necessarily, you cannot manage it. Everything, as a matter of fact, the American Diabetes Association will tell you that even someone who is well controlled on insulin, well controlled, they
Mhm.
have the same amount of risk of having a heart attack and of losing their limb as somebody who's not controlled.
Wow. Why
Yes.
is that? That's interesting.
Because, and the reason for that is the medicines you're taking is covering, but it's not fixing the underlying
Got it.
problem. I think of it like having a band-aid
Yeah.
over a wound, but the wound
Mhm.
is getting bigger, and every day you get a bigger band-aid. You're just getting a covering, but you're not stopping you're not dealing with the wound.
The
So
issue.
even though you may get more medication, you may end up getting more insulin. What is happening is that the inflammatory process is already working on your fragile organs. And so
Mhm.
after a while, what happens is that you start having kidney failure. You may
Right.
be on it well controlled, and you've heard people say, but my sugar has been controlled for 10 years, 15 years, and now I'm having kidney failure. Now I'm having a heart attack. And that's because you can't control. You have to go to the root.
Right.
And the
That's
root,
interesting. Go ahead.
mhm.
I'm sorry.
And the root is you really have to stop what is causing the cells to resist the insulin. You have to stop what is causing the excess glucose in the blood. You have to stop what is causing your body to be in a constant state of inflammation.
That leads to my question because I was thinking when you start talking about the root causes, I was going to ask you what are the top, say, 3 root causes of type 2 diabetes that maybe people are not being told?
The number one is inflammation.
Yeah, that
That
was new to me here on this call. You're saying,
the number one cause is inflammation. Most times people really don't know that. They'll tell you, oh, it's a high glucose issue, but it's not really the glucose that's the problem. So
Mhm,
one of the causes that most individuals don't know is the excess, and this is not about fat per se, but it's our diet with the excess amount of fats in our
mhm,
diet, processed fats, oils, and stuff.
mhm,
Most people always see type 2 diabetes, so too much blood glucose, too much sugar,
mhm.
or too much glucose. But the foods you eat causes your body to go into an even more state of inflammation. So one of the areas that I've worked with my clients is when I start eliminating the excess unnatural fats and oils,
Mhm.
their blood sugar that they usually are not able to control for years suddenly start falling.
Wow.
So most people don't see, like, because they hear of type 2 diabetes, elevated blood glucose level, they will eat a small amount of carbs, but
Right.
their food is loaded with all this grease and stuff. And so they're like, but I'm not eating any carbs, but my sugar is high. It's
Mhm.
high because of the oils and the processed things that we use in our body. So that's number two. And number three, I would say, is that it's a disease of habit,
Oof,
habit and
that's a
culture.
tough one right there.
It's culture and it's habit. So inflammation, most people don't know that it's an inflammatory disease. Number
Mhm.
two, they don't know that it's not necessarily the high glucose that's the issue. It's a
Right.
symptom of the problem, but it's what causes the insulin resistance, and it's the fats and the oils and the stuff that makes your body resistant. And also with our habits and our culture.
Right.
Our
That plays a
habits
big
and
role.
our culture, yeah.
Behavior, lifestyle, right?
Mhm.
Yeah, Shirley in MD says, yes, my inflammation is very high, causing high blood sugar, whether I eat anything or not. The doctor just gives her more insulin. That
Mm-hmm.
is interesting. And Felicia actually says parasites.
Parasites. I didn't want to go there, and I'm not going to go there more. But yes,
No, we need you to go there a little bit. Just share a little bit.
because more and more they're showing that a lot of the autoimmune disease is actually from parasitic infection, and most people don't want to hear that. They're like, "Oh, we're a first world country," but that's something I have to go in more. But that's more and more being present, that there's a parasitic also infection that results with the inflammation also.
Wow. See, this is very enlightening, guys. I hope you are taking notes, because one of the things I wanted to ask was, is medication always necessary, or are people being overprescribed, in your opinion, and just from your experience? Because a lot of what you do is behavioral lifestyle in terms of the changes with their diet.
Yes. So I'm going to be honest. There are times at the beginning, say
Mhm,
for instance, you're just diagnosed with type 2 diabetes. Your blood sugar is through the roof. Some
mhm,
individuals end up in ICU. You may start on the medication for a while, for
mhm.
like, while you're making the changes. So medication sometimes play a place to bring you to a place where you can start making the lifestyle changes, right? But what has happened is most times we take the medication as the problem, as the cure. So there are times when medication does play a role. I'm not
Mhm.
going to say it stabilizes you so you can continue, right?
Okay.
But medication does not fix the problem. It helps to stabilize you for a little bit, but then until you make the lifestyle changes to
Mhm.
support the transformation from the inside, you will continue to be added more and more and more medication. So medication does play a role in the beginning to
Okay.
get you stabilized so you can start making the changes.
Got it. And then what role does nutrition play versus medication?
Well, the type 2 diabetes, I like to think it's more of a nutritional disease than anything else, because it's lifestyle, it's habit. So nutrition is at the core, because when you think about type 2 diabetes and the excess blood glucose and the insulin resistance, it's from our diet. It's from our diet. So nutrition and lifestyle, and I'm going to say nutrition and lifestyle and mindset is the
Okay.
three main steps for curing type 2 diabetes. Nutrition plays a major role because all of us must eat to live. There's
Mhm.
not one of us here who can say, I don't need to eat. And because we all need to eat to live, and we have come to the place where we have lost, it's almost as though you can say the way we eat, especially in the Western world, is opposite to how our bodies were designed to eat, to
Okay.
work. We eat a large meal in the evening and then we go to sleep, right? But when you
Right.
think about the way our bodies are designed, when you wake up in the morning and the sun is up, that's when your body has the highest level of energy to
Mhm.
process the foods. But we eat small when there's plenty, and then we eat large when there's none. So
Yeah.
nutrition and the way we eat, and definitely the times we eat,
Mhm.
and and how we eat. So nutrition is at the core of reversing type 2 diabetes, but it doesn't matter if you know the right thing to do. That's Most people are still stuck because they need something more than motivation and willpower. They
Sure.
need a power that is outside of themselves to
Mhm.
help to start changing the way you think, because how we behave is based on what we believe.
True.
The belief leads to the behavior, and the behavior leads to the outcome, and the outcome leads to the consequences and the lifestyle that we end up.
Mhm.
Yeah. So
Wow.
nutrition is a major role. Moving away from the processed foods,
Okay.
sticking to the foods. I like to say God's foods, God way.
Wow. I like
God's
that.
foods, God way. Because if you think about the stuff that elevates our blood glucose level, increase our insulin resistance, you can't pick it off of a tree. One of the
Right.
most inflammatory foods, of course, is the oils, the vegetable oils, all these oils. You don't
Mhm.
see anything in nature where you can just pick a plant and you get oil pouring out like what we do.
Right. Right.
So if you eat God's food, God's way, in this natural state, unprocessed,
Mm-hmm.
Make that just a regular part of your life, you'll start realizing that your whole life start changing. You start feeling different, you start acting different, you start seeing transformation. But before you can even go to the behavior, you have to change what you believe about the stuff that you eat.
That's true. I mean, mindset is in anything that you do,
Mhm,
and as
mhm,
well as belief. One of the things that I always come across, even I do basic education in diabetes as a nurse when I was at bedside emergency department. But one of the biggest things that I find, particularly in Black culture, whether it's Black American, Black Caribbean, or African, cultural foods in terms
mhm,
of diabetes, because a lot of soul food for Americans, Caribbean food, and African flavors, a lot of it, yes, it's flavorful and they use herbs and spices, but there's a lot of starchy foods that are there as well. And so I wanted to talk a little bit about cultural foods, because one of the things that I had an issue with, I've never had diabetes or pre-diabetes, but weight loss and other things that I've been taught to do. What happens is a physician will come in the room, hear your story, and give you a piece of paper that they give to every single patient that's the
mhm,
same about changing your diet. It's actually rubbed out because they've used it for so long. And you
mhm.
have things on there that are like cottage cheese and all these things that honestly are just not things that a Caribbean person, much less some of the other cultures, would eat. So you start saying, well, what about yam? What about banana? These things that are you're used to eating in your own culture, and they think they either don't know about it, or they're like, no, you have to get rid of it. Don't have it at all. So I did want to find out how you approach that with some of your clients, and making sure that food is still enjoyable, even though we are taught, we should be eating to live, not living to eat.
Yes. As a matter of fact, that's such an amazing, that's a great question, Natasha, because the truth of the matter is that the cultural foods are the healthy foods when you eat them in right proportion. Most, almost most, well, all of my clients who have gone through the reversal journey, be it they're from Africa, from India, from Colombia, from Jamaica, we start with their cultural foods because
Mm,
it's not the cultural foods that is bad for you, it's how you eat them.
okay, that's good.
Like, even your parents were one of my clients.
Mhm.
They were taught how to use their cultural food, their yam, their banana, their dasheen, because
Yeah,
it's God's food, God's way. And
right.
the cultural foods, when you eat them in the natural state, it's just how you mix them and eat them. Then you'll find that they work for you. So
Hmm.
it doesn't matter what culture you is. And when my clients come, I usually sit down. It doesn't matter what culture. I said, let me see what are some foods in your culture that you eat. And invariably, we bring back like 60 to 80% of that cultural food in their diet. So we
Wow.
start from a place where they know and move into a different place. But individuals will not be quick to stay with a transformation if it is outside of what they're used to. And
True.
I believe, one of my beliefs is biblical, which says that what have you got in your hand? What you have in your hand. So I can't give somebody from India foods that are from Jamaica and they don't know that food.
Hmm.
In every culture, their food is suited for their body, but it's how we eat it. We have messed up the food for the most part, but when we go back to the culture of food and do it the way it's supposed to, that's how it works. Because my clients would not have gotten their results if I'd taken all their stuff and given them American food that they don't like, the cottage cheese. They're like, what is this? What is that? I can't eat that. I'm gonna die. I'm gonna die of hunger.
Yes. Listen, I said cottage what? I didn't, that's not something that I would
Yes.
even want to start working on. So I'm happy to hear that, because a lot of times, really and truly, that has been a complaint of many. Well, what if all of the foods that I'm accustomed to eating, I'd have to give them up?
No.
So I'm really glad to hear your program focuses on where they are, but teaching them in moderation and how to pair them, and I'm sure
Mhm.
timing as well.
Yes.
So
Start where
I'm
you're
really
at.
happy to hear that.
If you start in any journey, you have to start where you're at.
Mm-hmm.
So
Mm-hmm.
start right where you're at, because you can't get there if you don't start where you're at. And we teach them how to use what they have readily around them. And most times they'll think, oh, I have to go to the store to buy this. I said, let's see what you have. I mean, the processed stuff we have to remove and replace.
Sure.
But when you go into what is your culture foods, and I'm telling you, my clients, it's almost as though you've given them $1 million when they realize they can still eat their yellow yam, when they realize, they can still eat their fufu and their different foods that works with them. It's just amazing. So the food, the cultural food is the key, but it's not what you have, is how you use it. No spaghetti for the
Yeah.
island, definitely.
Felicia Clark says no spaghetti for island folks.
Mhm.
Yeah, my grandfather was like, no, I don't want that stringy stuff. This is good. So, my channel focuses on medical tourism specifically, but with Black women. One of the things I wanted to ask you when we talk about Black women is, why are we disproportionately affected by diabetes? It doesn't matter what culture we're from, but why are Black women disproportionately affected by diabetes?
One of the reasons I think that Black women are truly disproportionately affected is a lack of knowledge. I'm going to be honest, because they just, from what I've seen, we were just taught that, we should just, food was not a major issue. It's soul food, it's culture food. So it's a lack of knowledge. But more so, why they're disproportionately affected by type 2 diabetes is that the emphasis is truly not placed. Because let's go back. Before you were even diagnosed with type 2 diabetes, almost all Black women are diagnosed with hypertension. Hypertension, the underlying cause of hypertension is insulin resistance.
Okay. Wow.
And so, because you're being taught that, it's nothing, it's just a little hypertension, and because you're being told that, you have pre-diabetes, a lot of Black women say, oh, I'm not diabetic, I'm pre-diabetic.
Yes.
And that's a lie. I like to say a lie from the pit of hell, because pre-diabetes means that you're in stage 1 or stage 3 of type 2 diabetes. And that's where you're at the highest possibility of reversing. So lack of knowledge in that. They're disproportionately affected because Black women tend to take care of their men more than they take care of themselves. So your husband will be sick and you're focusing on him, but you don't take care of yourself.
Right.
And I don't even think it's totally Black women, it's women in general.
Yes. Yes.
And so because you focus so much on the family and on the men, you don't take care of yourself. And so most times, by the time you get around, you already have the complications. You know what I mean? By the time you stop and start paying attention, the complications have already begun to brew. But I think one of the main reasons why we are so disproportionately affected is the lack of knowledge. Lack of knowledge of the underlying cause. And also the feel that we don't need to take care of ourselves at the beginning. So we focus on everyone else, not knowing that if we're not healthy, we can't. And I also think that one of the reasons what I see with Black women being so really disproportionately is that the medical system is not geared towards helping to identify the occurrence of inflammation and type 2 diabetes at the onset.
Yeah.
There's not a lot of research done on Black women and type 2 diabetes. I just like how there was a time when there was not a lot of research done on heart disease among women, and the symptoms is different. So that's one of the lack of knowledge, the failure to care for themselves, and the lack of research that focuses on how does type 2 diabetes, present differently in the African American or in Black women in the population.
And that's important because honestly, that speaks to trust, or the lack of trust in the healthcare system in the United States in particular, because there is a history here with racism, systemic racism, and the biases that people hold, even in healthcare. People don't think it exists, but I've seen it. I'm sure you have, Barbara, in those who are caring for others. But a lot of Blacks do not participate in clinical trials and research because of the lack of trust that exists, having used and abused Black bodies over the years. Alicia says food is emotional. Yes.
Yes.
And she also said that people eat when they're happy, people eat when they're sad, people eat when they're bored.
Yes.
And Felicia Clark says sometimes we believe a larger size is healthy because men appreciate voluptuous shapes. And that is something that is seen in the Black community in particular, whether you're American, Caribbean, African, doesn't matter. That is
Mhm.
true. That is true too. Yeah,
Yes.
absolutely. So I now want to move a little bit into, since I cover medical tourism in particular, and then we're going to get into your book, which I can't wait to talk about. I did want to talk about, so I have a number of viewers who seek medical care abroad for a number of reasons. Sometimes it's access; it's just easier. So, the first is always going to be it's affordable. It's more affordable, and then in addition to that, what happens is either they're moving abroad or they're just seeking care abroad and then they would return. So I wanted to talk a little bit about diabetes travel and treatment abroad and what people should know. What specific questions should Black women in particular ask any international providers about diabetes care, maybe before traveling, or if they didn't, once they get there?
Okay. So one of the things, especially outside of the United States, um, they have to know the difference with diabetes care is like in America, we'll talk about the normal blood glucose level being 60 to 100. In some islands, they talk about 3.5, the numbers, the way in which so you have to understand the difference. So you may go to a different country and they tell you, they look at it from the A1C level and you're like, you don't really know what it is, right? You also have to, if you're a diabetic, and especially if you're traveling, you have to make sure the area that you're going to be getting this medical tourism, is it an area where you have access to fresh fruits and vegetables? Is it an area where you have no access to natural foods, right? Because if you're diabetic and you're going for medical tourism in an area where there's no access to just the natural foods, you're going to end up being more sick than not, because it's about healing, right?
It
Also,
is.
when you travel, you have to make sure, how are what's the diabetics or diabetic treatment plan in that country.
Mm-hmm.
you know um, how do they manage type 2 diabetes? If you get sick, where would you go?
Right.
How do the doctors see it? What is the treatment plan? Some countries, diabetes is seen like it's the norm, so there's not a major
Yes.
focus on it. So if it's a place where there's not a focus, you're not going to get the treatment that you need. So
That
you
is so
really need,
true.
it truly is not a focus. And what happens is a large population ended up with diabetes and they just accept it as the norm.
Right, right.
And,
And then
and
it progresses, and then you start to see all types of things like, unfortunately, kidney damage, as you mentioned, and getting
yes,
into amputations, because
yes,
diabetes affects everything, your vision, your movement, everything. So
yes.
it's interesting.
So you
All right.
really, I find that especially you really have to find out when you travel, like the area where you're going to be. Because truly, 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 if you are just doing stuff that's making it worse, you're not, even if you're going to get there for a procedure, diabetes affects that procedure
Mm-hmm.
because it's an inflammation in your body. You know what I mean? So if they're not focused on treating the underlying, it's going to be a challenge. And understanding how they read diabetes, how they read their blood sugar numbers, so you know exactly that you're not like wondering what is happening. Their numbers are different than how
Yeah.
we do it in the United States.
That's a good point, because the other thing is, what if they're diabetic, but they're actually going abroad, maybe for a surgery of some
Mhm.
kind, getting
Mhm.
their diabetes under control before they even go? Or what if their numbers increase based on whatever it is they're going for, or what they're there for? What kinds of things would you suggest they do before even going?
Before you go for a medical procedure, I would recommend get your blood glucose under control. Um, and I would recommend, yes, to start a more healthier diet, because
Mhm.
even if you're going for a procedure abroad and you're taking your medications, your diabetic medication, and your blood glucose seems controlled, remember, it's not really controlled, it's covered.
Right.
So I would focus on start getting your body healthier by changing what you're eating before you get there, so your body is better able to deal with it. But if you don't do that, you're going to be at higher risk of complications. You're going to be at higher risk of whatever procedure you're going to do failing. And so most times you ended up realizing that maybe this wasn't a good choice. And it's not that the area does not offer the medical tourism that's good, but because you were not prepared to receive it.
Yeah, that's a very good point. And Felicia Clark asked the question, how do you drive down blood glucose if you're traveling and have no access to meds?
How do you drive? First of all, you going to the three things: making sure that you're hydrated, right? One of the things that can shut down the craving that we tend to eat stuff that raise our blood sugar is that we get dehydrated. So start making sure you're hydrated. And one of the things I recommend in my program is making sure you're drinking at least 16 ounces of water in the morning, 8 to 16 ounces to kind of shut those cravings. If you're traveling and you have no access to medication, the key thing that you have to do is eat more fruits and vegetables. Like, be intentional about your diet. If you have no access to medication, then you have to just go back to what works and looking at the times you eat. So if you have to go back to doing the natural stuff, right? Looking at the times you eat, not eating after certain hours where your blood sugar is going to just be high, but there's no activity to drive it down.
And that goes back to what you said earlier, where the sun is high, having the larger meals and going a little lower as it gets darker and closer to bedtime, correct?
Yes. Yes. Okay. And then if you have no access, then you start making sure you're eating more greens if you have access to that, right? And you'll find that maybe when you come back, you won't even need the medication because you'd have developed a little better habit.
That's amazing. Light Session TV asks, can it be reversed after having it for so many years?
Yes, most certainly. It definitely can be reversed. As long, what I've always said, because type 2 diabetes doesn't mean your body does not produce insulin. It just means that there's resistance to there's maybe a less, but as long as you're producing insulin and you change your diet and you change how you eat, you start, the pancreatic cells in the pancreas start becoming way more sensitive to insulin. And so what happens is more blood glucose will go into the cells. So it doesn't really matter. I've had a client, as a matter of fact, who's been diabetic for almost 15 years, had an open heart surgery because he had a stroke, and he started the program, and in like 6 months, he had gotten off all his insulin.
Wow.
He gotten off all his insulin and he's still going strong. I had another client who, she had a massive stroke, was in a nursing home for almost 9 months or a year from diabetes, and she didn't even realize she was diabetic. And through the program, she was able to get off every medication. Wow. And as well as maybe like 60 pounds. So, and she thought there was no way out. So it doesn't matter how long you've had it. You can start reversing depending on where you're at, of course. If your pancreas is still producing insulin, yes.
That's amazing. All right, now it's time to talk about your book. Let's talk about, why did you write Breaking Up with Type 2 Diabetes in 40 Days, the Guaranteed Way? Tell us.
So there's a story behind this. So over the years of helping individuals reverse type 2 diabetes, there are times when my heart breaks, because I would see my clients, a couple of them who have gotten over it for a year or two, they'll call me and say, Miss Barbara, my stuff has gone back up, right? Or they've gone back into the habit. And I remember saying to God, I said, God, why? What, and I started taking it personal. And so that has been at the back of my mind. But a quick story. So my husband was my first client, right? And he has been reversed for many years, for many years now, and he's still reversed, doesn't take medicine, anything like that. One of the things I teach my clients to do is to be moderate in nuts. No, I have a nut issue. And I remember he used to go to Costco and he buys these big things of nuts. Um, and of course, I would be, every minute I pass, I get a handful. And one day he says, "You're being a hypocrite. How comes you're telling people not to eat and you're eating all these nuts?" And I'm like, "You are right." And I started thinking to myself, I wanted my husband to see the truth and God's love. So I'm like, "God, you got to help me." I was the type of person who, after every meal, I have to have nuts, 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 nuts.
Wow.
And I said, in that moment, I said, "Lord, you got to help me." And he had started showing me about 40. I said, "I'm not going to eat any nuts for 40 days." I thought I was going to die by the second day. I thought I was going out of my mind. By the sixth day, I was losing it. I was like, but I kept saying, "Lord, help me. If you can just get me through this." Long story short, in 40 days, I forgot I had a craving for nuts. Up until now, I no longer have an unrighteous craving for nuts. Like, I'll go days and weeks. I don't need nuts anymore.
Mhm.
Before, I thought every meal I had to have it. And I started doing research and I realized that in 40 days, that a lot of the individuals who have reversed their type 2 diabetes, maybe 2 years, and then sometimes go back to the old habit, is because their mind was not truly renewed.
That's true. That's true.
So they changed the behavior, but they did not change the belief.
Got it. Got
And
it.
so what happens is, despite their willpower, despite their desire to do, the belief was ruling their actions. And so
Mhm.
as I started burning and yearning, I realized that I have to align the biblical truth with the behavior and I realized that habits, most people say habits are formed in 21 days, but
Mhm.
biblically, if you look everywhere in the Bible, every time there's a transformation. Jesus was in the
Mhm.
wilderness for 40 days. Moses and the children, Elijah, all the individuals, 40 days seem to be the day of breakthrough.
Mhm.
I mean, not the day, but like, you need the consistency. And so
Sure.
I started um, aligning the biblical truth with each of the main principles and teaching that. And I saw transformation happening, because while you are learning the truth that will set you free, you're learning the actions that goes along with it. And I
Wow.
realized that it was not about not wanting to get it, but it's a fact is that they were powerless because they still believed a lie. They
Mhm.
believe, I have to give up all the food I eat, I have to give up these things that are not good,
It's so
that I
true.
like. It's like, I'm making a sacrifice.
Mhm.
It's not a sacrifice. If you're giving up something that's of a lower value for a higher value, you're stepping up. But because we were taught to believe that by not eating certain things, we were denying ourselves something.
Mhm.
Even though we are experiencing the transformation, we still believe, I'm depriving myself. And that's
Right.
because we had a wrong belief. The
Right.
truth had not. And so once I started teaching I realized that my clients, I started bringing them through what we call a 40 day, like 40 mornings for like half an hour. We start churning the truth. And after that 40 day, you realize that the change became automatic. It's
Mhm.
like you don't have to push and tell yourself, "Oh, I have to do this." No, it became like, "I want to do this," because now your
Mhm.
mind was in alignment with your action. So that's where this 40 days breaking up with type 2 diabetes. It starts with transforming the mind, helping you to align your consciousness with the truth so that
Mhm.
the behavior becomes an automatic process. You don't feel like you're missing out. You don't feel like
Mhm.
and so that's where breaking up is a 40-day biblical journey to redeem your health, your joy, your freedom. And in the book, you will see every day has a biblical precepts and foundation of truth that aligns with the action that you're going to take. And so
Nice.
as you meditate on the word of truth, it renews your mind and helps you to transform your life. And so for 40 days, you go through a 40-day journey of
Mhm.
renewing your mind. By the time you're done, the actions becomes automatic and your transformation doesn't feel like a burden, but it feels like
Wow.
a blessing.
No, that actually is a really unique approach to type 2 diabetes and reversing it, because a lot of times people do often think that deprivation is the way to go, because that's what they've been taught by physicians, by other clinicians. Everything is about, what can you cut, what do you cut from here, cut from there, you got to give this up. So I think aligning it with biblical truths, and also using 40 days to
Mm-hmm.
have this reset, if you call it that,
Mm-hmm.
this reset for this different approach, I think it is extremely effective. People don't feel as deprived, and motivation only lasts so long. So I think it's really important that you've done that. Is that typically how you handled your clients before you wrote this book?
Actually, that's no, I never handle them with the 40 days. What
Okay.
I usually have the renewed of the mind, and teaching them, and it works. But when I cried out to the Lord and said, Lord, seriously, you got to help me. I don't want to see anybody else go back. After you put in all that time, 2 years, you're off it to go back. And that's when he showed me, that through that encounter with my husband, and
Mhm.
seeing how just 40 days of making that commitment to not eat nuts, but instead of eating the nuts, I ate the word.
Right,
So
right.
every time I felt like, oh, I got to have it, I said, okay, Father, what word do I need to meditate on? I mean, at first I thought it was a joke. Me and the Holy Spirit was like, okay. And I realized, like 20 days, I stopped missing it. And he
Hmm.
brought me right through to the 40 days. And so every time I help individuals through this, I realize it's not just a change in a habit, but it's a renewing the mind. We talk about renewing the mind, but it has to be intentional. It's not
Hmm.
something that you can just say, you know what, let me read a verse today. It's like planting a seed. When you put a seed in the ground, sometimes you may not see anything comes up, but it germinate in there. And as
Right.
it germinates and it start breaks out, then you see a little budding. And as that tree grow into a big old plant, a big old tree, it has so much fruit. So that's what happens when your mind is renewed, that you won't walk and feel like, oh my gosh, I have to give up my oxtail. Oh my gosh, I have to give up my bun and cheese. You
Are
start
you
seeing
talking to
things,
me?
and it's not even you start seeing things in a different way. You're like, oh my word, look what I gain. Look how
Yes.
I feel. Because the belief leads to the behavior. And it's like you can cover your behavior for so long, but if the root keeps breaking out, you're gonna
Hmm.
keep going back. And so that's where this breaking up with 40 day has started. And each of the day has a principle, it has
Hmm.
the healing prescriptive word,
Oh,
plus an
nice.
action step that you follow, and a story behind of someone who has followed this principle and has won.
Oh, wow. I think that's so important. It helps someone see, hey, others have gone through the same thing,
Mhm.
gone through this walk. I think that's really encouraging, actually.
Yeah.
And what I like about your approach is that this is not only, I know it's focused on type 2 diabetes reversal, but that entire method you just explained is what
Mhm.
you can do for anything in life, that any habit
Mhm.
that you're
Mhm.
trying to break.
Mhm.
It can come for how you approach a job, how you approach a relationship. Following that principle of the 40 days and taking the word and using that as a guide to change your mindset, I think is
Mhm.
really important. So,
Mhm.
who would you say that you wrote this book for? Obviously, it is about type 2 diabetes, but what kind of transformation do you want that audience to walk away with?
This book is for anyone who is looking to live and not die, not only from
Mm.
type 2 diabetes, but from whatever ails them. Anyone who is looking to have a new mindset that will sustain a lasting action that will lead to life without feeling like you're deprived. This book is also for anyone who is ready to live,
Wow.
who's ready to give up type 2 diabetes. Um, not only get the results. I mean, I can help anyone reverse their diabetes in 4 months.
Yeah.
Anyone. But can you maintain that result? Do you
Mhm.
have the structure and the foundation to keep it? Do you, if you're struggling with cardiac disease, do you have the structure and the foundation to maintain that new building that you've built?
Mhm.
this new body that you're carrying. It's one of the reasons why, especially the weight loss industry in this country, is such a multi-billion-dollar industry, because
Yes.
it has no foundation. It
Yes.
has temporary gains, but long-term pain.
Right. Right.
So this book is, if you are looking to, if you're really ready to live, if you're really ready to break up, not just, force yourself into a bunch of habits for a period of time and then feeling miserable because you feel like you're giving up. If you're really ready to live and to enjoy the joy of life, walking in a way that will bring you sustained health and wealth and everything, this book is for you. As a matter of fact, I have my 25-year-old niece. I
Mhm.
went to Jamaica, went to a conference, and I had some books, and she took one, and she's a reader. She's 25, and she started reading on the bed. She says, Auntie Barbara, oh my gosh, Auntie Barbara. She is actually was reading it, didn't want to put it down. This is about type 2 diabetes, but this is about me. So,
Yeah.
and I've had a lot of younger people just take it up, reading it, and they're like drawn into it because they're
Mhm.
seeing the connection between how they think, what they do, and how they can keep the results.
Yeah, it's a life lesson. It's not only a health lesson, so it's applicable to all aspects of life.
Mhm.
TC, thank you for that heart. TC is actually aligns with everything that you've just said. So hold the book up for us, please, so we can see again Breaking Up with Type 2 Diabetes by Barbara G. Samuels, and tell us where we can get the book. You know, she's talking about breaking up within 40 days, the guaranteed way. So
Yes.
tell us where
And
we can get the book.
so you can get this book on Amazon. You can get this from Living All Alive, which is my website. Um, and you can get it overnight. And as a matter of fact, Natasha, I want to share with you, coming up in November, the second or so week in November, we're having a 40-day journey.
Oh,
So
wow.
wherein you can sign up for my community, and
Okay.
for 40 days, I will be there with you, going through days, an hour every morning for 40 days to help you get through that. And that's a 40-day plan. Um,
Okay.
and for those individuals who want not only to just read the book, but to want a community of support, you can also go to Living All Alive, join that community, and be ready to start with the 40-day coming up, so you can start renewing your mind.
Perfect. I have put Barbara's tags away that you guys can contact her or get in touch with her or access any of her materials. She has a YouTube channel. Please go and support her YouTube channel. Go ahead and subscribe. She has a lot of interesting information and videos that she puts out for you. It's Barbara G. Samuels on YouTube. And on Instagram, it's at Living All Alive. And her website, where you can also purchase the book along with Amazon, right? You can
Mm-hmm.
purchase the book through your okay.
Yeah.
www.livingallalive.com. So you can find her at all of those places. And please go out and support her, support the book. Tell everyone you know, those with diabetes struggling, those on their way to it. So hopefully they can stop and change course and live a more healthier lifestyle, and support her book. Make sure you guys go out and get her book. I always have a call to action at the end. I just want to make sure you guys please like this video. I know we had some technical difficulties in the beginning. Thank you for sticking with us. But don't forget to like, comment, subscribe, and share this video. It costs nothing to share this knowledge with others, and it'll also help the YouTube algorithm suggest this information to others who need it. Okay, so please hit the like button and share it. And I want to take this moment to thank Barbara again for taking the time to share her knowledge and insights on diabetes type 2 and about her book, which I'm hoping all of you will go out and support. Again, it is Breaking Up with Type 2 Diabetes in 40 Days, The Guaranteed Way by Barbara G. Samuels. Any last words you'd like to share, Barbara, before we end our live?
I just want to share with everyone that you are fearfully and you're wonderfully made. You were not designed to be stuck with diseases. You were not designed to be downtrodden by a disease that was never yours. And there's a pathway. And there's a guaranteed pathway that can lead you away from this disease, but even more than that, into a better life, into a better culture, passing on a tradition of health and wealth to your family. For those of you who have young children behind you, they'll see, look, mommy did it, daddy did it, I can do this. There you are the change, and you are the hope that they're looking for. And I can tell you, as we are getting ready, we're in November, and we're getting ready to go into the new year. Most people wait until, I'm going to start a New Year's resolution, which never lasts, because you have no plan, you have no support. But if you're really ready to walk into your next phase of life, then join our 40-day journey that's coming up in November. And let me hold your hand and guide you as you learn to renew your mind and take those little baby steps that will lead to big results. You should not settle. It's time to break up. It's time to break the mold and
That's
throw it
right.
away.
That's right. Tell us what, before we leave, the 40-day journey that you're talking about with community, please tell us when it's starting. Do you have it all set up on your website?
No, it's not all set up on the website yet. It's going up by the end of this week, the 40-day. But if you go and you just send me a comment, I will send it out to you the minute it comes. But I can tell you, it's it's something that you will be so happy that you did. Everyone who has come together for 40 days, they're like, oh my gosh, I can't believe I finally got over this. Community is very important.
It is. It is.
Community is very important.
Alicia left. Thank you so much. She said, so proud of you all. But Shirley in MD wants to know where you are. Is Miss Barbara in the U.S. and does she see patients? She is in the U.S. Go ahead, Miss Barbara. How can they connect with you? Maybe they need your assistance, not only through the book, but need to join your programs.
So if you can definitely connect with me through my website. If you go to Living All Alive, and as you put in your contact information, I'll reach out to you. And yes, I do have a coaching program. I have a program that anyone who is interested can go ahead, send me a comment, and I will get back to you and send you the link.
Excellent. All right. And I put everything in the comments. If you missed it, you can go back. It's her YouTube, her Instagram, and her website where you can access everything. And don't forget to go on Amazon and get her book, guys. All right. Thank you so much. And I appreciate you hanging in there through the technical difficulties, Barbara. I appreciate all of you hanging in there for that as well. This was chock full of a lot of information that is so useful to all of us, not only for diabetes, for lessons in life as well. So I ask that you share it again and go out there and live your best God-given life, everyone. Until next time, be well. Stay on, Barbara, one moment. But thank you, guys. Bye-bye.